I'm David Kerr, Professor of Cancer Medicine at University of Oxford. Or rather, I used to be. I'd like to talk about an interesting phenomenon about working with one's wife. What I found is that my individual profile has been subsumed into being the Kerrs. So I wonder how many of you work closely with wife or partner. Rachel, the other Professor Kerr, she and I have worked together for many moons, published together, researched together. But more recently, we actually do a joint clinic. And what do we mean by that? That we sit together in the same consulting room and see a long list of patients when we do our regular weekly clinic in Oxford. Because Rachel is a more substantive NHS employee than me, the appointments go to patients in her name. And it's always very interesting when patients come in to see their faces fall confused when you meet an elderly Scot rather than a ginger-haired Yorkshire woman, the other Professor Rachel Kerr, whom I quite often introduce as my older sister. This physically beggars belief, and again, patients are confused by our odd sense of humour. Strengths, we debate, discuss, do the best for the patients that we have, so you get two senior opinions instead of one, often simultaneously. We talk about patients when we come home at night. We sit beside each other on the sofa working in laptops. It often seems to me like two individuals working in a nuclear research facility rather than husband and wife, but nevertheless, it does allow us to do the best that we can for the patients that we have. So lots of upsides, I think, particularly for the patients. Downsides, there's just no getting away from the intermingling of life, such as it is in work. They're completely joined at the hip and synonymous. And I wondered just how many of you out there who are health professionals or who, as a part perhaps of the wider community of oncology patients that we serve, have ever come across something similar. The Kerrs, as we're known in Oxford, rather than David and Rachel, we've somehow become compressed together. I'd be really interested in your thoughts on it. Does it sound like a viable way to run a clinic, two senior oncologists sitting side by side and seeing patients and giving the benefits of both wisdom? Rachel much more involved in the administrative side than me, organising the chemotherapy, the various other elements that are of less interest to me. I do enjoy the patient discussions. I enjoy the technical, intellectual discussions that we have about time to optimise treatment to move things forward that way. So do we think this is a better deal for patients, or do we think it's unusually odd clumping together two rather senior clinicians in this way? I'd be really interested to see what you think. Patients love it. I mean, the feedback from patients is universally fantastic and enjoyable. Excuse my cough. Two talking heads for the price of one might say. But an interesting situation, and I'd be very interested to see what you thought about it, if you thought this is a sensible way ahead, or if any of you have come across anything like it. As always, thanks for listening. For the time being, Medscapers, over and out.